Hi, it's Callum. So this is lung. We're going to talk about lung quite quickly because, well, it's probably a specimen you won't encounter so frequently, particularly in your early training, especially lung resections, which tend to only happen in the big centres. Biopsies tend to happen more frequently in the other centres. Now, the main question you're trying to answer with a biopsy in lung pathology is generally, is it cancer or not? And if it is it non-small cell or small cell carcinoma? Small cell carcinoma is not amenable to surgery, but non-small cell carcinoma may be. And if it's non-small cell carcinoma, you want to subtype it because there's various types. And also increasingly, the genetics of lung cancer is becoming increasingly important and increasingly is determining which drug therapies can be offered to patients. So that's a developing area and has been in development for a few years now and is in practice now. So here we're going to look at just a basic level at lung histology. So the bronchial tree is just that. It's the lungs have a kind of tree-like architecture. If you imagine the trachea is like the trunk of the tree, and the trachea divides to give the primary, the left and right main bronchi, which divide into the secondary, tertiary bronchi, which again divide into bronchioles, terminal bronchioles, and then respiratory bronchioles, which feed the gas exchange units called the alveoli. So at the kind of proximal or trunk end, the wall, the lumen is at its broadest, the wall is at its thickest. There's cartilage within the wall, there are glands within the wall, and then as we move down the tree, the wall gets progressively thinner, the lumen get progressively narrower, the walls lose their glands and they lose their cartilage until eventually at the alveolar level, it really is just a single cell layer thick. So let's start at the proximal end. This is not the trachea, but this is quite proximal within the bronchial tree. We can see at the low power here, we've got the lumen here, lined by epithelium. Underlying that, there is seromucinous glands. Yeah, lots of seromucinous glands and cartilage. So we'll go into each of these in a bit more detail as we zoom in. So this is the epithelium that lines the bronchial tree, and it is, or at this stage at least, and it is pseudostratified, ciliated epithelium. So pseudostratified because all these cells connect to the basement membrane, but they just look like they're jumbled up. It's not true stratification, and they're ciliated. You can see the little cilia on the surface. Interspersed with these ciliated cells, there are mucin-containing cells called goblet cells, which the cytoplasm contains this light bluish stuff, which is mucin, which secretes onto the surface. The cilia beat it upwards as part of the ciliary escalator, which draws mucin, and pathogens and particulate matter, etc., upwards to expel it. So that's the lining. Underneath that, there's a bit of lamina propria, and there should be a bit of smooth muscle. Yeah, there's a wee bit of smooth muscle here, which you can see. We can identify this by now. Cigar-shaped nuclei and pink cytoplasm arranged in fascicles. That's smooth muscle. Underlying that, we've got some seromucinous glands. I can tell that they're seromucinous because they've got mucin-producing glands, which look like the goblet cells, that kind of pale blue, bubbly cytoplasm. And serous glands, which have got granular cytoplasm. They're a bit darker, and they produce serous secretions. So seromucinous glands will empty into this wee duct thing, which will transmit it to the lumen here. So seromucinous glands, lots of blood vessels. There's a nerve, connective tissue. And this is cartilage. I've not come across cartilage yet, actually, but this is cartilage, and this is hyaline cartilage. And hyaline cartilage is, it lines the bronchial tree, parts of the bronchial tree, the nose, articular surfaces. And hyaline cartilage, no matter where it is, looks the same. So we've got little chondrocytes here. Chondrocyte, and they maintain the kind of cartilaginous matrix, which is a mixture of sort of ground substance and collagen and so forth. So that's hyaline cartilage, and that's quite proximally within the bronchial tree. We're going to skip forward a few sections within this tree because basically this lumen will get narrower. We'll lose the ceremucinous glands and the cartilage. We'll get smaller and smaller. I think we're going to skip a few steps because it's going to be really difficult to demonstrate all of the levels, all of the levels of the bronchial tree, and basically life's too short, I think. Here's probably what may be a kind of a terminal bronchiole, maybe because it's lined by cuboidal epithelium that may have cilia. And they may be cilia, I'm not sure. Quite difficult to tell. Anyway, for practice and for practical purposes, we don't really care about any of that anyway. But let's have a closer look here at the alveoli. We can demonstrate a few things. So at the alveolar level, that is the other, right at the end of the bronchial tree, where the wall is at its thickest, where gas exchange happens. So these are the alveolar sacs here, these empty spaces full of air and life. And these are lined by a single layer of flattened, simple squamous epithelium. And these are called the type 1 pneumocytes. It's got another name. And these are flat. You can see these are flattened cells. So that's a flattened nucleus. There's a bit of cytoplasm. That's maybe the next one. That's maybe the next one. So a bit of cytoplasm. Next one. A bit lots of cytoplasm here until we can't find another one. And that's because this is the nucleus, and then there's lots of very stretched cytoplasm, and it's stretched very thin across the surface, and that's because that helps with gas exchange. So because it's so thin that that gas exchange can happen really efficiently. I'm trying to find a good area to demonstrate this. But here we have within the wall, we've got a capillary here, and I can tell it's a capillary because it's full of erythrocytes. And that'll be lined by endothelial cells, which are very flattened as well. In fact, it will look very similar to the type 1 pneumocytes. So there's probably a type 1 pneumocyte with cytoplasm. And there's that's maybe an endothelial cell for argument's sake, with cytoplasm here. So across here, there's very little. There'll be a thin epithelial cytoplasm, thin endothelial cytoplasm, basement membrane in between that, and very little else. So gas diffusion can happen efficiently. So these are the type 1 pneumocytes. There'll be endothelial cells. They're called type 1 pneumocytes because there are also type 2 pneumocytes. These are plump cells within the wall, which I find it very difficult to say what is a type 2 pneumocyte. That may be one. I think they're supposed to be nucleolated, if I remember rightly. But the plump cells within the wall, and these are the reserve cells that will replicate to produce the type 1 pneumocytes, but also they have an important role in producing surfactant. So that's it. Oh yes, this is the other main cell type here. So we've got lots of these within the alveoli. We've got alveolar macrophages, which have this central nuclei, abundant cytoplasm, fluffy cytoplasm almost. And if we look around, we'll probably see some that have got some engulfed material within them. This one here has maybe got some stuff in there. This one's maybe got some stuff in there. So these macrophages have engulfed material because they hoover up any particulate matter or other matter that's managed to get its way into the alveolar space. Alveolar macrophages. So type 1 pneumocytes, type 2 pneumocytes, alveolar macrophages. There will be Clara cells somewhere among this. They also have roles in producing surfactant, I think. I can't identify them. Don't know what they look like. And that's pretty much all there is to say in this quick introduction to lung histology. Right, we're getting there. So I think a few more videos to go, and then we're done. Hopefully you'll join me for that. So speak to you soon.